Hi guys, it's me, Professor D, and welcome back to my channel. On this video, you're going to learn how to correctly answer nursing questions on liver disease. If you haven't done so already, please be sure to like and subscribe below. Make sure you press that red notification bell button, so every time a new video is released, you'll be notified. So without any further ado, guys, let's get started. First question. A client's admitted with Atlantic cirrhosis. What data in the client's past history should you inquire about in taking a current history from this client? A, history of gallstones. B, history of alcohol abuse. C, history of viral hepatitis. Or D, history of heart disease. Go ahead, take a moment to think of your answer. If you're new to my channel or you just need a little bit more time to read the question and formulate an answer, just press that pause button, and whenever you're ready, press play and we'll resume. Okay, guys, so the correct answer is B, history of alcohol abuse. So Atlantic cirrhosis, guys, that is specific. That kind of cirrhosis is specifically for the alcoholics. Okay, when you see that word Atlantic, that type of cirrhosis, the first thing that should be going to your mind is that ETOH, the alcohol abuse. Okay, next question. A client's admitted with cirrhosis. The liver of this client's enlarged, and the nurse expects it's congested with venous blood. Which clinical manifestation would you expect to find considering the origin of cirrhosis in this client? A, left upper quadrant pain. B, pulmonary congestion. C, jaundice. Or D, vomiting. And I'll give you a moment to think of your answer. Okay, guys, the correct answer is B, pulmonary congestion. So I want you to think about this, guys. If you go back to the question, look at the source of the cirrhosis. Go back, look what it says. We suspect it's congested with venous blood. Think about it. Venous blood. What are the veins responsible for? It's responsible for bringing blood back to the heart, right? What's happening here? If that heart cannot pump blood out to the body the way it's supposed to, it does what? It backs up, it backs up, it backs up, it backs up. Where does it back up to? The lungs. You guys learned about this in A&P, right? So that's what you should suspect, pulmonary congestion. You should suspect that when you listen to the lungs, you may hear fluid in the lungs. You may hear what? Crackles. Should there ever be crackles in the lungs? No. The minute you hear crackles, you know there's fluid in the lungs. There's some kind of type of pulmonary congestion going on. That should not happen. We often see this when blood is backing up and not going to the human system the way that it should. Okay, so the correct answer is B. Next question. A client with end-stage cirrhosis develops severe vomiting and is admitted to a medical surgical unit. What complication of cirrhosis should the nurse be alert for in this client? A, guys, you know I can't pronounce. Intrahepatic bowel stasis. B, bleeding esophageal varices. C, decreased excretion of bilirubin. Or D, accumulation of plasma within the peritoneal cavity. And I'll give you guys a moment to think of your answer. Okay, guys, and the correct answer, we're on a roll. All of our answers have been B so far. The correct answer is B, a bleeding esophageal. And we got some clues in this question. They told us that the patient's at end-stage cirrhosis. So this patient's been dealing with this infection and inflammation of the liver for quite some time. They're at the end stage of it. And it says that the patient's developing severe vomiting. Well, where does the vomit go through? The esophagus, right? And think about it, that vomit is going to be very acidic, because if you're vomiting, it's stuff that's coming from the stomach that's full of hydrochloric acid. So that's your second clue. Let me see. They're on the med-surg unit, blah, blah, blah. Okay, so how did we get to bleeding esophageal varices? We'll look at our clues. The first one was about the end stage. The patient's liver has been in trouble for a long time. what is our liver important for? Yes, our liver is important for metabolizing medications. Absolutely. When the liver is not working properly, medications stay in the system longer. Patient can go through toxicity. Absolutely. But what else is the liver important for? Our clotting factors, right? Aren't those where our clotting factors are produced? So think about it. If that liver's in trouble and has been in trouble for a long time, don't you think those clotting factors are going to be affected? So that patient is at risk for bleeding. Okay? So that's our first clue. They've had this for a long time. We should be suspecting that they've got some kind of bleeding issues going on, right? That's why if a patient's going to get emergency surgery, what's one of the first questions they're asked? Are you a drinker? How often do you drink? When did you have your last drink? Why? Because alcohol messes with your clotting factors because it messes with the liver. The last thing we need is a patient that's about to go into emergency surgery. As soon as we cut them open, they hemorrhage to death. So the minute you hear cirrhosis, the liver's in trouble, one of the first things that need to be coming to your mind is bleeding. So that was our first clue. And our second clue was, where were we? The severe vomiting, right? And so you guys know what esophageal varices, esophagus, and varices is that bleeding that they have in the esophagus. So that is what should have brought you to the correct answer, which is bleeding esophageal varices. Okay, guys, next question. A client with end-stage cirrhosis is admitted with GI bleeding, becomes combative and confused. What complication of cirrhosis may this client be exhibiting? A, ascites. B, coagulation defects. C, TIA, which is your transient ischemic attack. Or D, portal systemic encephalopathy. This is a tricky one, guys, but I need you to put your critical thinking hats on. Okay, guys, so the correct answer is D. Portal systemic, what? Encephalopathy. Okay? Complete change in their cognition, complete change in their level of consciousness. They just told us in the question, number one, the patient has end-stage liver cirrhosis. That liver is not functioning the way it should. It's not breaking down meds the way it should. It's not metabolizing things the way it should. You know that the patient's not clotting. Their blood's not clotting the way they should. Toxins are staying in this patient's body. Okay? That's the first clue. And the second clue was the patient's combative and confused. Why do you think they're combative and confused? All of those toxins that are building up in the body because the liver's not functioning properly, that's what's causing them to be confused and combative, okay? A complete change in their level of consciousness, complete change. That's encephalopathy, okay? Our portal, which is the liver, portal systemic encephalopathy, a change in the level of consciousness, that's exactly what's happening. And the reason it's happening is because the liver's not functioning the way it's supposed to. So all of those toxins that are supposed to be leaving the body is just building up. And guess what? It's going to eventually get to the brain. Then the patient's got confusion, all this aggression, and they're being combative and all the other stuff that comes along with it. Okay? All right. What assessment finding would you expect to note in a client with cirrhosis who's exhibiting fetor hepaticus? A, purpuric lesions on the extremities. B, a fruity or musty breath odor. C, warm and bright red palms. Or D, jaundice of the sclera. All right, guys, the correct answer, I think everything's been B so far. The correct answer is B, a fruity or musty breath odor. Now, what is that fruity or musty odor? That's the smell of the toxins which have accumulated in the body because the liver is no longer functioning properly. Okay? Because remember, liver has many functions, and one of the functions is it acts as a filter, right? So it breaks down those toxins, it goes to the kidneys, and the kidneys excretes it in urine. But if the liver's not functioning in the way it's supposed to, instead of going to the kidneys to be released through the urine, it just builds up in the body. So that fruity or that musty odor that you'll smell on that patient's breath, that's really the smell of those toxins that have been accumulating in the patient's body because the liver is just not functioning the way that it should. All right, next question. Which laboratory data would I'm sorry, guys. It's been a long day. I can't speak. Forgive me. Which laboratory data would serve to alert you that the client with cirrhosis has advanced disease? A, elevated serum globulin levels. B, elevated serum ammonia levels. C, elevated serum protein levels. Or D, elevated lactate dehydrogenase. And guys, the correct answer is B, elevated serum ammonia levels. Okay, so what happens? Patient eats a piece of meat, they eat a protein. That protein gets broken down to ammonia. That ammonia is supposed to be broken down into urea by that liver. And then it goes to the kidneys to be excreted. But the kidneys are not functioning properly. So instead of that ammonia being broken down into urea to be excreted later by the kidneys, it just stays as ammonia. Okay? So we would expect a patient with advanced liver disease, we would expect their ammonia levels to be elevated because it's not breaking down the way it should. For a client with cirrhosis, what nursing interventions would be most appropriate to control fluid accumulation in the abdominal cavity? A, monitoring the INO. B, providing a low sodium diet. C, increasing PO fluid intake. Or D, weighing the client daily. Okay, so guys, the correct answer is B, providing a low sodium diet. Go back to the question. Look what it says. It says, which nursing intervention would be to control fluid accumulation? To control the fluid accumulation, you're going to decrease the sodium because what loves sodium? What follows sodium? Fluids. So the more sodium you have, the more fluid you're going to have and the more it's going to accumulate. So what are you going to do when you decrease that sodium? You decrease the fluid that would have followed the sodium if it were there. Now let's go through our other choices, guys. You have monitor INO. You definitely want to monitor the INOs on this type of patient. Absolutely. However, monitoring that INO is not going to help to control the fluid accumulation. So that's why that's not the right answer. Choice C, stop. Look at what's going on with your patient. Do you want to increase the fluid intake? No, that's wrong, period. Choice D, weighing the client daily. Absolutely, you want to weigh them daily. You want to see how much fluid they're holding on to. Absolutely. But the question is asking us, how do we control the accumulation of the fluid? And your correct answer is by giving them a low sodium diet. Less sodium, less water and fluids to follow and accumulate. The doctor's performing a paracentesis on the client with cirrhosis. For what potential complications of rapid removal of ascites fluid should you monitor this client? A, hypovolemia. B, systemic vasoconstriction. C, increased intra-abdominal pressure. Or D, rebound hypertension and fluid retention. Okay, guys, the correct answer is A, hypovolemia. That is something that we would watch out for if we were removing fluid too quickly. By the way, paracentesis, that's what it is when you're removing the fluid, right? So something that we'd be watching out for is hypovolemia. Now this patient doesn't have enough fluid in those vessels because we removed it too quickly. That's the correct answer. Now let's look at our other choices. We have B, systemic vasoconstriction. Actually, It would be dilation. It would be the opposite, so that's wrong. Choice C, increased intra-abdominal pressure. No, if we remove fluid too quickly, we'd be looking out for the opposite, which would be decreased. So that's wrong. And then we have D, rebound hypertension. Well, how would we have hypertension if we're removing fluid? So that's wrong. We would be concerned with the opposite, that patient actually going through shock, not having enough fluid, enough volume within the vessel. So the correct answer would be A, hypovolemia, not having enough fluid volume within those vessels. That's what we'd be concerned with, which would completely, drop the patient's blood pressure. That would decrease perfusion. That patient would have a whole other set of problems and issues that we'd be dealing with. Okay. A client with advanced cirrhosis has begun treatment with lactulose. The client reports experiencing several soft stools per day. What is your best response? A, this is the normal expected response to this medication. B, you may take kaopectate liquids 3 times per day for loose stools. C, do not take any more of the medication until I check with your doctor. D, we will need to send a stool specimen to the lab for culture and sensitivity. And the correct answer, guys, is A. This is normal. This is the normal expected response to this medication. Think about it. This patient has cirrhosis, and we're giving them lactulose. We're giving them lactulose so they can have bowel movements. But why do we want them to have bowel movements? Lactulose binds all that ammonia that the patient's not getting rid of. Remember, the ammonia is building up in the body. It's becoming toxic. It's causing the patient to have encephalopathy and all these other issues. So we need to get that ammonia out the body because it's sure not breaking down into urea and coming out in the urine. So we got to get it out somehow. So we give them lactulose. And it binds the ammonia. So when the patient has a bowel movement, it comes out the butt. We got to get it out somehow because normally, the ammonia breaks down into urea when the liver's working properly, and that urea is excreted in the urine. But because the liver's not working properly, that ammonia never gets broken down in the urea, and it turns toxic in the patient's body because it's building up. We have to get rid of it somehow, and that's why we give them lactulose. So when the patient says that they're having several soft stools per day, good. That's what we want to see happen because we want to get that ammonia level down, and that's how we do it. The nurses administered lactulose to a client with cirrhosis. The following day, the client reports having 7 loose stools in the past 12 hours. What alteration in laboratory data would you expect to be present in this client as a result? A, hypokalemia. B, hyponatremia. C, hypercalcemia. And D, hyperglycemia. Excuse me. And the correct answer, guys, is hypokalemia. Based out the butt. When the patient has diarrhea, and we know it's a lot of, look, patient had 7, and look at the type of stools they had. Loose. They weren't firm. They were loose stools. So this patient's got diarrhea, right? Base comes out the butt. So when a patient has diarrhea, they're losing all of their base, right? And that can throw them into acidic state. So what are we expecting to see? Hypokalemia. All that potassium is coming out, okay? Just like when a patient has lots of vomiting, it throws them into an alkalinic or basic state because all of the acid that was in their stomach, they're losing it. So now they're in an alkalinic state. When the patient has the opposite, diarrhea, all the base is coming out their butt, it throws them into an acidic state. So with this patient with diarrhea, we expect them to have hypokalemia because that potassium is coming out in the stool. And so that's what we expect that patient to have, hypokalemia. Client diagnosed with hepatitis A asks you how the infection may have been contracted. What is your best response? A, some medications have been known to induce hepatitis A. B, you may have been exposed through contaminated shellfish. C, you may have been infected through a recent blood transfusion. Or D, you have had Epstein-Barr virus before and hepatitis A can co-infect you. And the correct answer is B. You may have been exposed through contaminated shellfish. And guys, it's not only contaminated shellfish, it could have been through contaminated water or even very close personal contact. The patient could have contracted hepatitis A. Now let's look at our wrong answer choices. Choice A, some medications have been known to induce hepatitis A. Medications have been known to induce, toxic hepatitis. Okay, so when a patient has toxic hepatitis, that's from medications. Next choice B, you may have been infected through recent blood transfusion. That's actually hepatitis B. You know, blood transfusion or infected needles or sexual contact, that's hepatitis B. And then our last choice, you've had Epstein-Barr virus before. Okay, the Epstein-Barr virus, what does that cause? Mono. All right, so the correct answer for this is B, contaminated shellfish. But remember, with hepatitis A, it's not only contaminated shellfish, it can be contaminated shellfish, it can be contaminated water or a close personal contact. Which of the following clients is most at risk for developing hepatitis B? A, a 24-year-old college student who's had several sexual partners. B, a 54-year-old who takes acetaminophen daily for headaches. C, a 33-year-old businessman who travels frequently. Or D, a 72-year-old woman who has eaten raw shellfish. And guys, you all should have gotten this answer correct. I'm not going to even give you a time to think about it because I just gave you the answer when I was giving you the rationales for the last question. So the correct answer is A, that 24-year-old that has had several sexual partners. Remember, with hepatitis B, it could be contracted through sexual contact, blood, or infected needles. Okay, so A is the correct answer. B, C, and D are all wrong. A client who's jaundiced and is suspected of having contracted hepatitis B has been admitted to the hospital. Which of the following nursing interventions would be most appropriate for this client? A, encourage bed rest during this period. B, assist the client with ambulation to prevent thrombus formation. C, place the client on a clear liquid diet to reduce the workload on the liver. Or D, medicate the client with as needed prochlorperazine, compazine to relieve nausea. And the correct answer is A, bed rest. Guys, look at what is going on with the patient. The patient's jaundiced and they're suspecting of having hepatitis B. Okay, so we know that bilirubin is not being conjugated. They're jaundiced, right? What do we want to do? We want to rest the patient. We want to rest the liver. We want to decrease the metabolic demands on the liver. And how do we do that? By resting the patient. So A is the correct answer. You're going to put them on bed rest. You want to make sure that you rest that liver and you decrease those metabolic demands that have been placed on the patient's liver. What statement made by a client who's traveling to a non-industrialized country indicates the need for further teaching regarding the prevention of viral hepatitis? A, when traveling out of the country, I'll drink bottled water. B, I will not share my drinking glass. C, I should eat plenty of fresh fruit. Or D, I will use careful hand washing. And the correct answer, guys, is C, I should eat plenty of fresh fruit, because what this question is asking us, what requires further teaching? That means which one is wrong. All the other ones are right. Drinking only bottled water, that's good. We want to do that because we don't want that patient contracting hepatitis A from contaminated water. So that's good. B, I will not share my drinking glass. That's right. You don't want to be sharing saliva. You could get hepatitis A from that close contact. You don't want to do that. You don't want to be swapping, spitting. You get hepatitis from somebody else. So that's correct as well. Good. And then choice D, I'll use careful hand washing. Absolutely. You don't want to go to the bathroom get feces under your nails or on your hands, and then you go eat something and it gets in your food, okay? All that can cause you hepatitis. But look at C, I should eat plenty of fresh fruit. How was that fresh fruit rinsed? Right? It's fresh fruit, right? So you're going to go and eat a raw apple. That raw apple had to have been rinsed, right? With possibly contaminated water. That can get you hepatitis A. So that's the wrong one. You're going to have to do further teaching with that patient. All of the other choices are correct. Okay, next question. Client diagnosed 8 months ago with hepatitis B is suspected of having chronic hepatitis. What serologic marker would you expect to be present if the client is indeed a carrier of the disease? A, anti-HCV antibodies, B, anti-HBs antibody, C, HBsAg antibodies, or D, HAV antibodies. And guys, the correct answer is C. As a student, automatically, you should have gotten rid of A and D. Why? The question's asking us about hepatitis B. Choice A, HCV, they're talking about hepatitis C. And then choice D, HAV, is talking about hepatitis A. The question's asking us about B. So you should have gotten rid of choice A and D automatically because they're talking about another type of hepatitis and not hepatitis B. So that leaves you with choice B and C. Your anti-HBs antibodies and your HBsAg antibodies. And the correct answer is C, your HBsAg antibodies. And let me tell you how you know this so you never forget. That G in the HBsAg antibodies, that G stands for gangster. Yeah, it's gangster. That means it's not going anywhere. It's here to stay. Bring it on. I don't care what kind of medication you bring about. I'm not leaving. It's gangster, so it's chronic. It's not leaving. It's chronic, okay? So when you see the G, I want you to think of the gangster that's not going anywhere. G is chronic. G is here to stay, okay? So when you see that AG, you know it's gangster. It's not leaving. It's chronic. All right? Okay, next question. Client with acute hepatitis B has begun treatment with ribavirin verazole. What manifestation would alert you to a serious side effect of this medication? A, anemia, B, pedal edema, C, sensory neuropathy, or D, decreased gastric motility. All right, guys, and the correct answer is A. This medication, guys, can cause severe anemia. And that severe anemia is not something that you'll see happen slowly over days. It happens very quickly. It's very sudden. So you have to be watching out for that very closely, okay? You better be looking at the CBC, specifically the RBCs and the hemoglobin for this type of patient, okay? So you're gonna expect the doctor to be ordering serial blood counts. And like I said, you're gonna be looking at the red blood cells and you're gonna be looking at that patient's hemoglobin because that medication, a major complication, adverse effect is anemia, severe anemia. A 28-year-old client's involved in an MVA and they're brought to the emergency department. What clinical sign would alert you to the presence of possible liver trauma? A, abdominal pain referred to the right shoulder. B, right quadrant abdominal pain and swelling. C, abdominal pain that is referred to the spine. Or D, abdominal pain with accompanying rebound tenderness. Okay, guys, the correct answer is abdominal pain referred to the right shoulder. This is what's known as the Kerr sign, guys. And this pain that the patient gets that's referred to the right shoulder, they get it especially when they take a deep breath. So they go like, and then, ah! And it's so painful to them, okay? That's known as the Kerr sign. And you see that specifically when you tell them to take a deep breath, and that's when the pain gets worse. And you're going to suspect that they have liver trauma. All right, guys, we're down to our last question, and this is perfect because I just finished my coffee, and you guys know how I work without coffee in my system. A client who underwent liver transplantation 2 weeks ago reports a temperature of 101 and right flank pain. What would be your best response? A, the immunosuppressive drugs that you're taking may make you susceptible to infections. B, you may be rejecting the transplanted liver and should go to the hospital immediately. C, you should take an additional dose of cyclosporine today. Or D, take acetaminophen every 4 hours until you feel better. All right, before I tell you what the answer is, guys, as a student, you should have gotten rid of C and D because we are not doctors and we're not going to play doctor. How you going to tell a patient to take an extra dose of anything? Excuse me? You trying to lose your license? Absolutely not. So C and D are completely out of the question. So you have A and B, and the correct answer is B. We have some hints, guys. Our first hint was liver transplant. Guys, whenever you guys get a question about a transplant, any type of transplant, there should be some things at the forefront of your mind. And one of the first things you guys need to be thinking about is rejection. And another thing you need to be thinking about is infection. And the third thing you need to be thinking about is hemorrhage, in that order. In that order. So they told us transplant. So we're worried about rejection. We're worried about infection. We're worried about bleeding, hemorrhaging, right? Let's keep going. And in the question, they tell us temperature of 101. And it was 2 weeks ago. So there's possibly, it could be infection, right? But look at our other hint, right flank pain. When you couple that together, you have the temperature going up with that pain, and they told you that the patient had a transplant. You need to be thinking of rejection, and you're going to tell that patient to get back to the hospital immediately. Okay, this is a medical emergency. They need to come immediately, and that's the correct answer. By the way, something else that's also a symptom of rejection, it's not on here, but I just want you to know, for if the patient got a liver transplant, if you see them starting to turn yellow, jaundice, that's also another symptom that their body's rejecting that organ. Okay, so you're not going to tell them the immunosuppressive drugs you're taking may make you susceptible to infections. Even though that's true, that is true. The patient's going to be on high dose immunosuppressive agents, and that may cause them to get an infection. That is absolutely true. But the patient has all these symptoms, and you're just going to tell them that, and that's it? Absolutely not. You're going to tell them to come in immediately because that's what you need to suspect is happening, and you're going to get them care. Okay? A suggests that you just tell them, oh, it just makes you prone to infection. So they have all these symptoms, and you're not going to do anything about it? Absolutely not. The correct answer is B, and now you know why. Guys, I hope you found this video to be helpful. I know a lot of you guys struggle when it comes to, you know, the liver and the gallbladder and these GI issues. So I'm really going to try to make a video for each organ separately and go in depth just to make it more clear to you. If you haven't done so already, guys, please do not forget to like and subscribe below. Press that red notification button. Share my videos with anyone you know that could possibly benefit from them. A friend, coworker, anybody in nursing school, anybody studying to take their boards. I thank you so much for watching this video, and I'll see you on the next one.